Hey everyone, and welcome to the Balanced Bodies Blueprint. I am your host, Vinny Russo.
And I am your co-host, Dr. Eryn Stansfield.
And we're shifting gears from all the conventional fitness narrative you hear on most fitness podcasts, as our main emphasis lies in preventative healthcare, adopting a holistic approach to nutrition, and challenging the traditional views on various fitness topics.
Our mission with this podcast is to provide you with the information you need to achieve optimal health.
And on today's podcast, we are going to be discussing everything fluoride, as fluoride happens to be a pretty big thing now that RFK is taking office. So we're going to dive deep into the history, the science, and the multiple controversies that are surrounding fluoride in your drinking water. And Dr. Eryn will be taking the lead, so I'll be asking the questions here because she knows more about it, way more about it than I do. So why don't we just have you discuss the origins of where putting fluoride in water began. Like when did it happen, and how did that idea of adding fluoride to drinking water first come to light?
All right. So in the early 20th century, there was a dentist named Fred McKay who noticed that there were brown stains on teeth in Colorado Springs. And researchers discovered that fluoride in the water actually caused these brown stains called dental fluorosis. But it was around this time also that they figured out that fluoride could prevent cavities, which was you got to understand back in the early days, early 20th century, that getting any kind of dental problem or dental abscess was a big deal and very painful. And, a very not sought after treatment. People would wait a long time and to go to the dentist because it was so painful.
Yeah. So when did this actually begin in the United States?
So it actually began on January 25th, 1945. They started in Grand Rapids, Michigan. It was the first city to implement water fluoridation. And this basically marked the beginning of a long-term study on fluoridation's effects. So we have lots of data basically that goes back in time from 1945 until now.
And then how quickly did this actually, how quickly did this spread throughout all of America? Because you're saying that it started really in Michigan. So how quickly did it spread?
So by 1950, about 1.5 million Americans were receiving fluoridated water. In 1952, the number tripled to 13.3 million people. So a lot of data here in people, right? By 1965, New York City's adoption led to the largest annual expansion, adding 13.5 people.
Well, I mean, that's pretty expansive going, in just 2 years. So was there actual, any endorsements or to help this grow that rapidly? Was there anything that actually came behind it to push this forward?
Yes. So in the 1950s, the American Dental Association and the Association of State and Territorial Dental Directors, and of course the U.S. Public Health Service endorsed community water fluoridation. And again, it was because they saw a decrease in cavities in people, and especially children. The U.S. Surgeon General strongly encouraged communities to fluoridate their water.
Well, I was doing a little bit of research on this when you brought this to light, and I knew you were going to take the lead. But I remember reading something, and I can be mistaken here, but did the military get involved, or am I skipping over things?
No, they also got involved. In 1954, Ramey Air Force Base in Puerto Rico became the first U.S. military installation to fluoridate its water supply. And by 1976, 146 military bases had fluoridated water systems.
So if we're talking about today, and I'm not sure if you know the numbers offhand, but what's the fluoridation coverage today?
So we'll talk about 1980s. Half of the U.S. population received fluoridated tap water. In 2012, it's about 67% of the U.S. population. So it's not everybody. Everyone assumes it's everyone. It's not everybody. But a lot of communities, depending on what the fluoride content is in that community, will either add fluoride to their water or not add it to their water.
Yeah, so it's pretty widespread in the U.S., but just not everywhere, but it's definitely widespread.
Correct.
All right, so let's talk a little bit about the CDC, because the CDC considers this water fluoridation to be one of the greatest public health achievements of the 20th century. So why is it viewed that way by the CDC?
Well, fluoridation actually reduces tooth decay by about 25% in both children and adults. Studies show that children in fluoridated communities, so that have fluoride added to their water, have on average 2.25 fewer decayed teeth compared to those in non-fluoridated areas.
Wow. Yeah, so besides its effectiveness with tooth decay, what are going to be some other advantages that fluoridation of water can actually bring to a community?
So there are other effects. So secondary effects. Communities that have fluoridated water save an average of $32 per person annually by avoiding treatment for cavities. The return on investment is significant, with an average of $20 saved for every $1 spent on water fluoridation. It benefits all members of the community regardless of age, education level, or income, helping to reduce oral health disparities. I think this is really important especially now with all the, when people talk about income disparity, this is a big one, trying to equalize dental health disparity.
Yeah, take-home money is obviously huge, and that's one of the political elements that took place in this last election. So we're going to touch on this a little bit more in a later question, but really quick, what about the safety of this fluoridation of water?
All right, so I think this has come to light because of RFK, and people are questioning, like, well, what is the safety of fluoride in the water? And I've even seen some crazy stuff, cited, like there's no fluoride in Japan or something like that in their water. Anyway, I digress. Over 75 years of research and experience have shown that community water fluoridation is safe. We have, like I mentioned, lots of data from 1945 that have followed people throughout their lifetimes.
Yeah, so what about in terms of reach?
So as of 2022, 72% of the U.S. population served by community water systems. More than 209 million people have access to fluoridated water. So it's a lot of people, essentially.
Yeah, that's a ton. And I know you mentioned that there are more benefits than just the tooth decay stuff. I know you briefly touched on it, but can you dive just a little bit deeper into the broader health benefits that can be seen beyond dental here?
Yes. So fluoridation contributes to bone strength, reducing osteoporosis risk. It improves academic performance by preventing dental issues that lead to abscesses, which I had mentioned earlier. It reduces systemic infections by lowering inflammation markers. Fluoridation also reduces healthcare costs, saving $16 for every dollar spent, and may indirectly benefit conditions like diabetes, heart disease, and pregnancy complications by improving oral health.
Well, I think this is a good transition now into the controversies and the conspiracies that are being spewed out, especially now in what we've seen. To be honest with you, I didn't know all those extra benefits, but let's address some of these controversies. So I know you said that there's over 75 years of research and experience here, but are there really any safety concerns when it comes to water fluoridation?
Well, I'll talk in general and then I'll answer, but in general, no. Expert panels consisting of scientists from the United States and other countries with expertise in various health and scientific disciplines have considered available evidence in peer-reviewed literature and have not found any convincing scientific evidence linking community water fluoridation with any potential adverse health effect or systemic disorder, such as an increased risk for cancer, Down syndrome, heart disease, osteoporosis, and bone fracture. Also included in this list, immune disorders, low intelligence, renal disorders, Alzheimer's, or allergic reactions.
Wow, yeah. So I know that there's a lot of stuff now, especially on podcasts, where they're talking about the lower intelligence. So despite all of that, with what you just said, there's really no shortage of these conspiracies that, some critics like RFK Jr. Are pushing out there. And they have claimed that fluoride lowers the IQ, it reduces intelligence, and might even be a form of population control. So what does the science actually say about all of those claims?
So claims about fluoride reducing intelligence largely stem from a handful of studies that looked at high levels of fluoride exposure in areas outside the United States where fluoride levels in water far exceeded the optimal levels recommended. These studies often had poor designs, so that's a big problem. Failed to control for confounding factors. This is a big deal, like lead exposure, malnutrition, and they weren't directly comparable to fluoridated water systems in the U.S. When you don't control for confounding factors like that, especially something like lead exposure, which actually could harm a child's IQ, then you can't really take that study seriously. For example, there's a study from China linking high fluoride levels to lower IQ scores, but the fluoride concentrations in those areas were many times higher than what's used in American water systems. More importantly, these findings haven't been replicated in any high-quality studies in the U.S.
So, in essence, these claims might be based on isolated studies that don't typically apply to the fluoride exposure that we see in the U.S.
Exactly. So peer-reviewed evaluations in the U.S. have consistently shown no credible evidence of fluoride negatively impacting brain function at the levels used in our public water supplies.
Yeah, and this just brings to light like another conspiracy theory that it gets recycled because it's basically saying that like fluoride was used to control populations or having ties with Nazi Germany, because the idea is that like fluoride was used by these Nazis to basically make the populations docile, right? Now, there's no historical or scientific backing to this claim at all. To me, from the amount of research that I did on this specific conspiracy, I feel like it is a myth and it has been widely debunked, but it still pops up in discussions, right? It still pops up and is fueled by the mistrust of the government and pharmaceutical companies in particular.
Yeah, I had you told me about this and I hadn't heard that. I don't doubt it. It sounds very feasible that somebody would come up with that kind of conspiracy theory. There was a lot of medical experimentation going on in Nazi Germany at that time. So actually, some valuable research unfortunately came out of that.
So it's pretty safe to say that Dr. Eryn won and controversy 0 right now. All right. So, but were there any legitimate concerns raised in scientific reviews? Because it can't be perfect, right? I know there has to be something.
Yeah, of course. Whenever, again, the dose makes the poison, right? So the only documented risk of community water fluoridation is dental fluorosis. Again, that has to do with the amount of fluoride, which is primarily cosmetic issues, but changes range from barely visible lacy white markings on the teeth in mild cases to pitting of the enamel in rare and severe cases. Most dental fluorosis seen in the U.S. today is very mild, so you don't really see this today because our levels are pretty low in our public water systems, and so it really doesn't affect aesthetics or dental function.
But it's usually seen mainly in children, correct?
Yes, usually young children, typically less than 8 years of age, whose permanent teeth are still forming if they consume excessive fluoride from multiple sources, such as toothpaste. Some kids eat toothpaste and they don't spit it out, so there's that, and supplements in addition to fluoridated water. Recommendations provided by the U.S. Public Health Service for optimal fluoride levels does take that into account. Again, they're kind of recommending the dose or the amount in the water in the public health or in the public water systems.
So to wrap up this idea, so like while fluoride conspiracies, they make for very compelling headlines, as you can see, they get a lot of attention. The data continues to show it's safe at regulated levels, correct?
Yes, exactly. So after more than 75 years of research and monitoring, there's overwhelming scientific consensus is that community water fluoridation is safe, effective, and one of the greatest public health achievements in the 20th century.
All right, so before we end this discussion, because I think you really put a nail in the coffin here, let's take one quick step back and talk about the CDC really quickly. Does the CDC mandate water fluoridation or not?
No, actually. So CDC does not mandate community water fluoridation. The U.S. Public Health Service recommended fluoride level is not an enforceable standard. So this is a recommended level. State and local governments decide whether to implement water fluoridation. That means it's a state decision. Often voters themselves make the decision to adjust water fluoride to improve public health.
Wow, yeah. And I think that's, I think that goes into people believing that the government as a whole, it should be not trusted, right? And then they look at the CDC and everything that happened with COVID. And it's almost like now some people are looking at the CDC with this, and they're trying to make a connection here, but the CDC does not mandate this community water fluoridation. So let's wrap this up. Are there any last insights that you want to give to our listeners today about the fluoride in their water?
I just think it's interesting because this really was a non-topic until RFK was nominated, obviously. And all of a sudden it started popping up because, he's written some things in book publications and his own, commentary saying that he was against fluoridation. And so I think it's interesting that this has been put to bed essentially for the past, 70 years. And then all of a sudden people are concerned about it when, there are other concerns out there besides this.
Well, look, I think Dr. Eryn, what you just did is pretty insightful and hopefully sheds a lot of light on people who are questioning this. Even someone like myself who loves to dive into conspiracies, not that I believe them, but I do think that they are pretty entertaining. I think that this, just puts that to shame. Now, anytime someone brings it up, it's like you have the information to be able to debunk what they're actually saying. So thank you for all of this insight and shedding light on this area.
Yep, anytime.
All right, well, we'll see you all next
So on behalf of Balanced Bodies, we just want to say thank you for joining us on this episode of the Balanced Bodies Blueprint.
We are committed to bringing valuable content. And if you enjoyed today's episode, we'd greatly appreciate it if you can take a moment and like it and leave a 5-star review.
On Apple, just go to the show, scroll down to the bottom and rate it there. If you're on Spotify, go to the show's page, click the 3 dots, and you can rate it there as well.
And if you believe in the power of knowledge, share this episode on your social media to try and get the information out there to as many people as possible.
And as you navigate your own path towards better health, remember that Balanced Bodies is forever in your corner. See you all next week.
The podcast content may include discussions of medical topics and health-related information. However, the information provided should not be considered exhaustive or complete, and it should not be relied upon as a substitute for professional medical advice or treatment. Always seek the advice of your physician or other qualified healthcare providers with any questions you may have regarding a medical condition or treatment.